Hello, and welcome to today's video. In this video, we'll be looking at the benefits of physical activity in the management of central and peripheral neurological disorders, including Parkinson's disease, multiple sclerosis, spinal cord injury, pain, and stroke rehabilitation. Parkinson's disease is a neurodegenerative condition resulting from the loss of dopaminergic neurons in the substantia nigra, in the nigrostriatal pathway. This pathway regulates the output of the basal ganglia, a collection of subcortical structures which play a role in movement planning and amplitude. Parkinson's disease is predominantly a disease of the elderly, characterized by both motor and autonomic symptoms, which can make physical activity difficult. A mixture of orthostatic hypertension, increased incidence of falls, bradykinesia, freezing of gait, depression, and side effects of treatment can lead to a spiral of decompensation and deconditioning, which may potentiate these symptoms and the lack of physical activity. This vicious cycle can be tackled. Several studies demonstrate that physical activity is associated with improvements in walking speed, muscle strength, axial mobility, and reduced number of falls in patients with early Parkinson's disease. Balance training, in combination with resistance training, has also been shown to be more beneficial than either alone. Furthermore, physical activity can provide psychological benefits such as improved mood, bringing sufferers of Parkinson's disease together, and providing a social support network for patients. Exercise, alongside various medications, should form part of the formal management of Parkinson's disease, which is reflected in the NICE guidelines. MS, multiple sclerosis, is a demyelinating condition of the central nervous system. MS can manifest in different ways: loss or blurring of vision, paresthesia, incoordination, weakness, and bladder dysfunction. There are different types of MS, but the most common is relapsing remitting MS, 50% of which go on to develop secondary progressive MS. Due to the nature of the disease, many patients will eventually develop problems with mobility and severe fatigue. Furthermore, symptoms are often worse when patients become hot. These factors can act as barriers to physical activity and may explain data showing that patients with MS are far less active than healthy controls, such as within this study, which demonstrated lower daily step counts in patients with MS. Recommendations such as having a cool shower before and after training may help tackle these barriers, as well as various techniques which may improve fatigue in patients with MS, including medications, education, activity modification, compensation, and exercise itself. A Cochrane review indicates that exercise improves muscle function and power, increases mobility, and can improve mood for patients with MS. Other potential benefits include improved quality of life and reduction in cardiovascular risk. Consequently, NICE recommends exercise and physical rehabilitation in the management of MS patients. However, caution should be taken in significant heat or corticosteroid treatment. Several studies also advocate the use of physical activity to improve symptoms of other neurological conditions, including traumatic brain injury, stroke, motor neuron disease or ALS, in mice through mechanisms such as increased neurogenesis. Some data also suggests this may be the case in humans too. Thank you for watching this video. For further information, please see the links presented shortly. Remember, exercise and rehabilitation should not be forgotten in the management of neurological diseases. In both Parkinson's disease and MS, exercise has been shown to improve mobility and quality of life for patients. Although both diseases come with unique challenges, as future clinicians, we should do our best to encourage and facilitate adaptations to help our patients remain active.